computer and we will get started. Hello, it's the 19th of June 2019. We have some questions on our Zoom call that we want to go over first, and then we will open it up for questions. Everybody is muted right now, so if you do have a question about what I'm talking about, you can raise your little hand on your thing, and you can type in a question there. First question was about medical immunotherapy. That is the new drug that is a non-chemo type drug for cancer that people have questions about. So how does it work? Is it really immunotherapy? Because you think of immunotherapy, well, you're thinking you're stimulating your immune system to help kill the cancer. So we have to kind of take a step back and understand a little bit of physiology on why my immune system isn't effectively killing my cancer in the first place. So one of the struggles that our immune system has in killing our cancer is that cancer is our own self-tissue. So normally T cells, macrophages, your immune white blood cells are not supposed to attack self-tissue. Otherwise it'd be called an autoimmune disease. So you have in your cells, you have this receptor, and it's shown in this picture here, not to get too technical, but it's your PD-L1 receptor that actually attaches to your PD-1 receptor on a T cell that tells the T cell, tells your immune cells that, hey, this is self-tissue, don't kill me. This is throughout your whole body. Tumor cells are not the only cells that have this PD-L1 receptor on it. All your human cells have this receptor in order to tell the immune system not to kill it. Now, what is supposed to happen with a growing cancer is that the immune system should override this and kill this growing cancer because it should sense it as being abnormal. This cancer is growing and replicating and replicating and replicating. It should sense it as abnormal. It should kill it. But part of the problem in our immune system's inability to do that is this PD-1 receptor. What the immunotherapy drugs like Keytruda do is they are an anti-PD-1 analog that attaches to that receptor on both the PD-L1 or the PD-1, and there are some other receptors that could get much more technical because there's other drugs that are very similar to Keytruda that are attacking different receptors, because there's several different receptors in this family of receptors. And what these drugs are doing is binding to that receptor, so my T cells will now attack the tumor cell. Well, that sounds like a wonderful thing, right? The problem is that this issue here is not the whole story, and it's not the whole problem with most cancers. That's why Keytruda and the immunotherapies are only approved for certain cancers. And then on other cancers, they're only approved after chemotherapy has failed. And some people have said, well, that doesn't seem right. My sister used Keytruda and it actually worked, and they won't give me Keytruda. They said I have to do chemotherapy first. Well, the reason is that your type of cancer, this isn't really the problem. So they only approve Keytruda for your type of cancer when chemotherapy fails. They got nothing else in the tool bag. That's how this works. Now the problem with this, you think, wow, this is miracle drug, and it is wonderful. So this is where my integrative training is like, wow, this is fantastic. This is a really cool drug set for really stubborn cancers. If they express the problem, and there's a way to do the testing, the genetic testing, if it's really a PD-L1 problem in the first place. Now, it's not exact science, but it's the best that we have right now. Then Keytruda may be very effective. Now, there's huge side effects with it because it's not going to be specifically binding this anti-PD-1 to just the PD-L1 receptors on tumor sites. It does it throughout the whole body. So you take Keytruda and you're administered an immunotherapy drug, it does this to all your cells. So one of the things you'll be told is that one of the side effects of an immunotherapy drug for cancer is that you could / probably will get diseases that end with an itis. Colitis is your #1 thing that a person will get. Most people on Keytruda, they're going to get colitis. It's because your immune system is now, your T cells are going to start attacking all your cells, all your normal self cells. So the first thing that, because your immune system is so strong in the gut, it's going to start attacking your gut wall cells. So you end up with colitis. So very common side effect of Keytruda is bloody stools, horrible diarrhea, and people can get this to whatever degree. So that is an issue that you have to deal with. We've had people have lung issues. We've had people, their thyroid just goes crazy and they end up with Hashimoto's or a Graves' disease. We have people lose their hearing. We've had people, list goes on and on. You're basically dealing with multiple autoimmune diseases. That's the risk in taking these drugs. Now, to temper that down, we've had people take these drugs with very little side effects. So everybody's going to react differently to these. So I don't want to knock them. I think they're fantastic. It's a great class of drugs that it's going to be really neat if it can be specifically attack the tumor cells. That hasn't been figured out yet. That is a hopeful thing in the cancer realm for those watching these drugs. It can be a really big help, and we're hoping that that does that. But that's the medical immunotherapy drugs that are out there. Again, it has only been shown to really be really effective with certain types of cancer. And then even with that certain type of cancer, your body has to express this PD-L1 issue in the testing in order for it to really be classified as a drug of choice for that person. Next question was about enzyme therapy. We've gotten multiple questions about enzyme therapy. What is enzyme therapy? I have multiple videos on our website on enzyme therapy and on the blog post and in our YouTube video library on enzyme therapy and what we have done. It stems from Dr. Kelly's work, who really put it on the planet as far as a cancer therapy. Actually, he got the information from Dr. John Bard's work back at the early 1900s. But Dr. Kelly used it for himself, for his own cancer. He used it for multiple patients that he helped work with cancer. And then later, a student of his, Dr. Nicholas Gonzalez of New York, who has now passed away, who I actually trained under. He was a wonderful guy, by the way, super great guy. And he used Dr. Kelly's protocol, basically, with pancreatic enzymes. So enzyme therapy with cancer is taking high doses of pancreatic enzymes to help digest the slime layer that is a waste layer that builds up around a growing cancer because of the metabolic activity that's taking place in rapid replication in this cancer. And helps break that down and gives your immune system the ability to kill it. So we said back here that one of the reasons why our immune system isn't effectively killing cancer is that the cancer cell is turning off the immune system's ability to kill the cancer. But there's other reasons. The reason why these drugs, well, if that was the only reason, then these drugs are a miracle drug and everybody's going to be cured of cancer. The problem is that's not the only reason why a person's immune system isn't killing the cancer. So another major reason is because a growing cancer mass is going to build up a protein shell around it, a waste shell around it, and that's where high dose enzymes can be beneficial. Now, this is different than taking digestive enzymes for helping you digest your food. Maybe everybody should do that. You could argue that, but taking digestive enzymes to help break down your food you take with your food, or right before your meal, or right after your meal. You're getting the enzymes in there to help break up proteins so that you better digest and you can better absorb, take some pressure off your pancreas and take some pressure off your intestinal tract. You're going to have a greater absorption rate. A lot of gut issues are because of poor digestion. Remember, digestion is the breakdown of macronutrients into smaller nutrients that we can absorb, and we have malabsorption problems because we don't do that very well, especially when we have decreased stomach acid production and so much stress on our pancreas that we have decreased enzyme production and just the bad diet of the foods that we're eating. Enzyme therapy for cancer is taking very, very high doses in comparison. So let's say if I'm going to take one enzyme pill before my largest meals, with cancer enzyme therapy, depending on what type of enzymes you're using anywhere between 15 capsules twice a day to 75 capsules twice a day on an empty stomach. Now, part of the problem with Dr. Kelly's approach was compliance. Taking that many pills on an empty stomach became problematic with some people. Now, we have discovered using fermented enzymes and an improved formulation, we've been able to use the same protocol with a much lower dose. This is the same as Dr. Kelly's enzyme formulation that he used with this Pancreatic 8 Plus. You have to use a much higher dose. So if somebody was doing Dr. Kelly's protocol, they might be taking 35 to 75 of these twice a day. We typically tell them in the morning right when they wake up, don't eat for an hour to two, wait an hour or two to eat before bed, take these right before bed. With the digestimes, we have people taking anywhere between 5, 10, 15, 20 in the morning and the same in the afternoon, and it varies upon dose, and we test people on that. But this, you can take a much lower dose. They're both about the same size capsule. This makes it more doable to do. Should every cancer patient be doing this enzyme therapy? My belief, no. So just like should every cancer patient be doing chemotherapy? My belief, no. Should we be doing immunotherapy? No. Should we be doing protocol? No. You want to be as specific as possible and come up with a protocol that's going to work for that patient. But this is something that is just another cancer therapy that I'm answering questions on that I want people to know what it is. We have videos on this, but don't take just because I'm doing some information on this that everybody should be doing this. So that's enzyme therapy, helping break down the cancer by using pancreatic enzymes to help break down that shell around the cancer so your immune system can get at it and kill it. All right, so now I'm going to open it up. I'm going to unmute everybody and open it up for questions. I have about 10, 15 minutes here. We can get some questions in.
No questions here.
Okay, so keep asking. Everybody's asking really good questions on the Facebook page, and everybody's chiming in with answers, and that's what it's really about. We want you guys to be participants, helping one another, supporting one another, loving one another, encouraging one another on that page. Everybody has a ton of knowledge, and if you can help people with your experience and your knowledge, it's just such a blessing. So I encourage you to continue to do that. That's why we put that page together in the first place. We just love to see that it's starting to really flow. Okay, Thanks so much for participating, and make sure, again, a reminder, if you have specific questions that you want to dig into some answers with anything, that you email the questions to the Connors Clinic at Gmail or the info at Connors Clinic, but please put in the subject title Zoom question, because we literally get at least 200 emails a day. So put in there
Yeah,
Zoom
straight ahead.
question, and I'll make sure I catch it, and we will be on it. All right. You guys have a wonderful day. Know that I'm praying for you all the time.
Not this light, but the next one. Take a right.
I will see you guys next week.